Dear friends, we are about to welcome and extremely eager to listen the best star, only legend right now available with us, Dr. Rajan Sankaran sir. अपने कुर्सी की पेटी आप बांध लीजिए क्योंकि कुछ ही मोमेंट में सर यहाँ पे आएंगे और अपना प्रेजेंटेशन देंगे. अपने कंटिन्यूसली सी प्रोसेस क्या होती है, नेचर, कॉन्सेप्ट और साइंस. गिव अ बिग राउंड ऑफ अप्लॉज. हियर ही कम्स Sankaran sir. Please switch on the light. Lights of auditorium should also be on a bit so that he can relate with the crowd. सब लोग अपनी कुर्सी की पेटी बांध लीजिए so that we can have a wonderful fly in the world of sensation. I must invite the moderator of the session, Dr. Bhaskar Bhatt and Dr. Kasim Chimtanwala sir, to take the seats over the dais, please.
Hello. नहीं.
Kasim Chimtanwala sir.
It's good. I can see it here. Very good. Okay. Can I change it? I can't change it. Okay. So hello everybody, and I would like to share some few things with you. What I want to share? I want to share with you that, see, homeopathy is effective. It works. It gives good results. You know it. You have seen many cases. Many cases have been presented here also. But the question is, are we able to be consistent with our results? होम्योपैथी काम करती है, इसमें कोई शक नहीं है. Why are you clapping? Just listen. I'm not a politician. You don't have to clap for me. Listen to me. होम्योपैथी काम करती है, इसमें कोई शक नहीं है. लेकिन क्या आप हर केस में रिजल्ट दे पा रहे हैं? Answer is no, it's not true. One of my teachers, surgery teachers in college, he used to say, a homeopath is like a man with a gun sitting in the middle of a field with the gun pointing upwards. And every minute he will fire one shot, thak, thak, thak. And once in a while, one bird will pass just over that bullet. And the homeopath will say, look, what a great shot I made. Don't clap, listen. I'll tell you when to clap, okay? Piche, okay. So when we prescribe specific remedies, when we prescribe patent remedies, when we prescribe combination remedies, when we prescribe pathological remedies, it is a chance. Kabhi lage, to lage. No, I don't want. Please don't interrupt me. Take it away. Thank you. Okay, good. Is that the homeopathy you want to practice? कभी लग गया तो लग गया, नहीं लगा तो नहीं लगा. How can we find more consistent results? So, I have been working on this for last 40 years at least. And what I found was, next slide, that if we can find a system along with symptoms, the chances of our success are so much more. And I want to talk about this today. So Hahnemann gave us the law, similia similibus curantur. It means that when a remedy matches the state of the patient, healing can happen. Is it correct? Yes or no? You know Hahnemann? Good. Healing can happen. But what are we going to, just Kyle, follow my hand. It is similar to what? When you say you have to, it is similia similibus. Similar to what? Go on. So, traditionally, homeopaths prescribe medicines based on symptom similarity. Symptoms of the patient are matched with symptoms of the various remedies to find the closest fit. This is what many homeopaths do. And this has worked beautifully for last 200 years. So, while this method had a lot of success, there have been failures too. Maybe it has to be similar to other aspects, not only symptoms. Why? Because when you take symptoms, you take 10 symptoms, 15 symptoms, then you get sulfur, calcarea, lycopodium, natrum, mur, phosphorus, sepia, whatever. Which one to choose? You see? Then you have to do some kind of guesswork. Or if you choose one set of symptoms, you will get one remedy. You choose another set of symptoms, you will get another remedy. Am I right or wrong? So, can we look at the patient from some another angle, not only the symptoms? And this is what we have been working on and created something called a system approach. There is a symptom approach, there is a system approach. And what is this system approach? Along with understanding what are the symptoms of the patient, we try to also know what is the kingdom of the patient. Is it a mineral kingdom, plant kingdom, or animal kingdom? Secondly, we also try to know what is the superclass of this patient. And thirdly, we also try to understand what is the miasm of this patient. These three things, kingdom, superclass, and miasm, it forms the system. It is another way of looking at the patient, along with symptoms. I will explain each of this and make it very simple and illustrate it with cases. These three coordinates, namely superclass, kingdom, and miasm, we get to see another aspect of the remedy or the patient besides the characteristic symptoms. If you take these both together, your results are so much more sure. Just try to understand this little bit. So here is a little movie that we made. You see? So similar to different aspects. The remedy must be similar to different aspects. What are these aspects? Once again, the superclass. What is the superclass? It is the core dynamic response. Don't worry, I will explain it. What is the kingdom? It is the type of response. And what is a miasm? It is the speed of response. So this is what, we'll understand this. You will follow it very clearly. Don't worry right now. And so now if you see this, what we are showing you here, you see, there is an object in the middle, but if you throw light from the top, it looks like a circle. If you throw light from the side, it looks like a square. And if you throw light from this side, it looks like a triangle. These three sides, the three coordinates are of the same object. Similarly, these three aspects, superclass, miasm, and kingdom, are of the same individual, just three sides of it, three coordinates of it. When system information and symptom information are matched, the success rate is far better. The confidence with which you will prescribe that single remedy is going to be so much more. This is what I discovered after 45 years of studying homeopathy. And I want to share it with you so that you can use it in your practice. This development from the beginning till the current moment, I have written in my book, which is called From Similia to Synergy, the evolution in homeopathy. So you are free to read this. You will understand my development, which I am going to summarize right now. What is a kingdom? I'll make it so simple, you will be able to apply in your practice. If the main problem of the person is I, it is a mineral kingdom. If the main problem of the person is something, it is the plant kingdom. If the main problem of a person is somebody, it is the animal kingdom. And if the main problem is it is a no-sod. Do you follow this? Or should I explain? Explain. Very good. So, a mineral kingdom person says, I lack or I lose something. Do you follow? Something is missing in me or something is going away from me. The problem is my resources. I am not good enough. I am weak. I am dependent. You see? So the problem is in my structure. You see? The plant person says, something affects me and I respond to it. And the animal person says, somebody is victimizing me and I want to get back at that person. Do you follow this little difference? Yes. Suppose you see, there is a young girl, say 20-year-old. She says, I have disappointment in love. I was in love with one fellow and he let me down. Have you heard this story? Have you heard it in your practice or no? I hear it every day. Every day. All 20-year-old girls go through this. Yes or no? What's the difference? Now, the first girl will say, oh, I was so dependent on him. He took all the decisions for me. He gave me all the care. He gave me all the love. And now, who can I go to? Who I will depend on? How can I live without him? Have you heard this story? This is Netramure, for example, mineral kingdom. Another girl says, you know what happened? Every day, WhatsApp. Good morning, good evening, good night, how are you? What did you eat? What did you sleep? And suddenly he blocked me. What? Something shocking. Now he doesn't respond. So what is the problem? Something that happened. Are you following? And I'm reacting with a feeling of shock. This could be Ignatia, for example. The third girl says, oh, he thinks he's better than me. He thinks he will find somebody else. I will show him. I will make his life hell. This is animal kingdom. You can give lachesis. For example, are you with me? Do you follow this? I, something, somebody. It's easy to understand. So this is another way of looking at patients. How is this person responding? And then you can choose a remedy from that kingdom along with symptoms. Your prescription is stronger. Is this easy to understand? Okay. Let's go to the next one. We'll talk of miasm. What is a miasm? Miasm has many definitions. But the definition I would like to share with you is that miasm is the pace or the speed of the perceived situation. Does this person perceive this as something sudden? Acute miasm. Or, oh shit, I have to stay with this. I can't do anything about it. I better accept it. This is psychotic miasm. Or, I will kill him. This is syphilitic miasm. So, is the pace sudden, fixed, or destructive? It's a different type of miasm. Yes? So, for example, belladonna would be an acute miasm. Thuja will be psychotic miasm. Mercury will be syphilitic miasm. What is the attitude of belladonna? Everything is sudden, isn't it? Boom! And what is the face of Thuja? Everything is slow. Everything is fixed. Fixed ideas, fixed thoughts, obsessive tendencies. And what's the theme of Mercury? Kill, destroy, finish. So the other miasms also, but just to give you a little bit of an idea. This is the second way we can understand people. So he belongs to a particular kingdom, to a particular miasm, and then to a particular super class. What is a super class? Let's understand. So this is, no, go one step back. This is the map of miasms as I made it, where the miasms are located, not in the anatomical area, but as a map. Okay. So I have described kingdoms and miasms in my book called The Substance of Homeopathy, which I wrote more than 30 years ago. And this holds as true today as it held at that time. Go on. The latest idea that I have, and I want to share with you, and I want you to know that you are the first audience that I'm sharing my super class idea with. What is it? No. No shawl, no topi, nothing. Just simple man. No applause. What is a super class? A super class is the core dynamic response. Let's understand. So I said there are 6 super classes. What are they? Let's go. The first super class, the idea is the basic core response is withdrawal, is to go inside, is to shut the world outside, to go into a shell or into a womb. So anything happens, introverted. Do you follow like this? Don't want to face, put the shell there. For example, an oyster is like that, an oyster. Or for example, a remedy like opium. What does opium do? Too much pain, become anesthetic. No feeling anymore. The world is outside. Opium is gone into hibernation. You follow like this? Hello? Yeah. So, withdrawal, shut off, cling, hold on, don't face. It's too much. So these are people who are introverted. Their nature is like that. Pulsatilla is also in the first super class. Mild, yielding, clinging, soft, gentle, not willing to face anything. Okay? The second type, second superclass, go on, is open and shut. That means you are inside, but occasionally you want to see outside because it's too boring. It's grey inside. It's little boring, dull, grey, no sensory stimulation. So once in a while, you open the window. I can feel something, etc. And then when there is any danger, close the door again. Open and shut. Like a snail. You know what is a snail? You know snail, I don't know the Hindi word for it. You know better. You know, like a snail. How the snail, when there is danger, pulls inside, but when there's no danger, he tries to be outside. So it's outside and inside. So that is the second superclass. The third superclass is boundaries. I am free, but within my boundaries, within my limitations. I can do anything, you know. But if I go outside, it is risky. It is adventure. This is the third superclass. The fourth superclass is I want stability. I don't want any change. I want to be where I am. Think of a remedy like bryonia, who want to go home. Think of a remedy like Calcarea carbonica, who want his family, or Kali carbonica. You know? This is it. The fifth superclass is the opposite. He says, I want to get out. I want a change. I want to go out of here. I cannot sit. I'm very restless. You see? Because inside I feel more stuck and more suffocated. I cannot be here. I want to get out. I want to move. Think of remedies like Rustox, tuberculinum. These kind of remedies you can think like that. Argentum nitricum. Eh? Get out, claustrophobic. This is the fifth superclass. The sixth superclass is violence and destruction. It's now a life or death situation, and what you do is fight or flight. Everything is speeded up. It's adrenaline. Think of a remedy like lachesis or mercury or aurum or even stramonium or belladonna. These are all in the sixth superclass. So what I did, I bunched remedies into six superclasses, into groups. And then this is another way of understanding individuals. So you can understand them through kingdoms, through superclass, and through miasms. And if you understand all this, and if the remedy matches all of this and the symptoms, it's a guarantee that that remedy will work. No doubt. No doubt. That's what I wanted to share with you. Then comes characteristic symptoms. To all this, you add characteristic symptoms. I'm going to give you some cases. This first case is a case of a boy, 6-7 years old, with a condition called spinal muscular atrophy. It is a genetic condition which causes weakness and atrophy, where the muscles become very thin, and it can affect the child's ability to walk, sit up, control, and then finally even the breathing muscles can be gone. In general, people with SMA experience a progressive loss of muscle control, movement and strength. It only gets worse and worse and worse. And they cannot walk, they cannot sit, they cannot stand, they lose their ability to do all these actions, and this situation gets worse and worse and worse. There is no treatment for it. The prognosis you can see. Next. They tried to develop some drugs for it. There is a drug called Zolgensma, and the cost is about 16 to 18 crores. And what is beautiful about that is that it is not a cure. It cannot reverse the damage that has happened. Your muscles cannot get strong, cannot get, it cannot stop the atrophy, cannot reverse. It can only maybe stop it at the stage at which it is. So this is the kind of condition the child was brought. This is 3 years old. Go on. They came in 2021 October. And where are the symptoms? There are rashes, there are lots of skin problems. He cannot support himself when climbing the stairs. He cannot get up from a sitting position. His weight is going down to 9.6 kilogram, and his SMA test has come positive. You can see the test report here. Go on. What is the state of mind? He is very obstinate. He doesn't listen to anyone. If things don't happen according to him, he will tear the pages of the books. He throws things. He hits the other person with a fist. He bangs his head on the floor, throws his toys, rolls on the floor, and bang his head to the wall also. This kind of mental state. He is destructive when he's playing. He doesn't like, and he always likes to travel. Wherever his father goes, I want to go, I want to move. I cannot sit in one place. I'm very restless child. You can say like this. He likes eggs and fruit. He sleeps on his stomach, like this. And so here you can see this movement and this stubbornness are very good qualities of the fifth superclass. Always want to move, to travel. And you know very well that the main remedy for that is tuberculinum, isn't it? And you can see that the symptoms, throws things, striking his head, knocking against things, obstinate children, liking to travel, liking for eggs, liking for fruit, sleeps on the stomach. So here you can see the superclass, the symptoms, everything is matching the remedy picture of tuberculinum also, the essence of tuberculinum. You know this, you know tuberculinum children, they can, so stubborn, you take them, I want, Papa, I want, and they will go on the floor and I want, yes. You know this or no? I can tell you a story that I had the greatest fear of having a child, thinking maybe he will become tuberculinum. Oh shit, I better not have children. That kind of, you see. And I remember one very nice advertisement on television or wherever it was. You know, one man is taking his small child, one boy, to the supermarket. And the boy says, I want that, I want. He says, no, I want. And he throws the things, he throws there, bangs his head, and his father doesn't know what to do. He's just looking, my God. And then it says, use condoms. It's an advertisement for condoms. I think it's a very powerful advertisement, if you ask me. That's the picture of tuberculinum. So this child fitted very well with this picture, you see. So we gave him tuberculinum, 1M, and followed by LM8, everyday doses of LM8. What is the difference between tuberculinum and tarantula? This is very interesting, but this also shows us the difference between the kingdoms. To this restlessness, if you add attention-seeking behavior, if you add rhythm and dancing, if you add competitiveness, and if you add teasing somebody else, you know, he will go and hit his sister from the back and run away. Me versus somebody else, this deceitfulness, this cunning, these are animal qualities. Because I am doing to somebody else, somebody. When you add that, you get tarantula. Are you following like this or no? So just the restlessness and stubborn tuberculinum and this rhythm, dancing, attention seeking. There was a child in my clinic, lot of cough, you know, cough. He came once, he came twice, and he was not getting better. So one day, after 2 weeks, he came with his mother. Mother was saying, no, usko khansi aati hai, doctor, bahut zyada hai, raat ko aati hai. Child was sitting like this quietly. And then suddenly he said, Hey Shankaran, meri khansi kyun nahi theek hoti hai? Hey Shankaran. Small child, 6 years old. This is tarantula. You see the rubrics, abrupt and threatening and impulsive. Hey Shankaran. See? This is tarantula. So like this, you can differentiate remedies from kingdoms and from symptoms also. They are all the same thing. So what happened to this child 16 months later? Play.
फिर बाकी का हमने आनंद क्लिनिक है वहाँ पे डॉक्टर गुजराती, तो उनसे कंसल्ट किया, बच्चों का पैडियाट्रिक है वो, तो उनसे कंसल्ट करने के बाद में उनको कुछ डाउट आया, तो डाउट आने के बाद में फिर डॉक्टर सारा बोल के वहाँ पे सुपर स्पेशलिस्ट न्यूरोलॉजिस्ट, तो उनके पास गए हम। उनके पास जाने के बाद में उन्होंने 2 हमें टेस्ट सजेस्ट किया था, तो वो टेस्ट में से जो था वो पहला एसएमई का था और दूसरा एमआरआई था। इसमें नहीं डिटेक्ट हुआ तो इसमें हो जाएंगे बोले। तो उसके बाद में हमने जब कंसल्ट किया उनको, मुझे लगता है अगस्त में हुआ था, अगस्त 5 अगस्त को कुछ तो भी रिपोर्ट आया था उसका। फिर वो कंसल्ट करने के बाद में उन्होंने बोला कि उसको जो है तो एसएमए डिटेक्ट हुआ है बोले उसको 2nd स्टेज में, तो आप एक तो आया में, फिर उसको कुछ डाउट आया तो फिर बाकी का हमने आनंद क्लिनिक है वहाँ पे डॉक्टर गुजराती, तो उनसे कंसल्ट किया। बच्चों का पैडियाट्रिक है वो, तो उनसे कंसल्ट करने के बाद में उनको कुछ डाउट आया, तो डाउट आने के बाद में फिर डॉक्टर सरा बोल के है वहाँ पे सुपर स्पेशलिस्ट न्यूरोलॉजिस्ट, तो उनके पास गए हम। उनके पास जाने के बाद में उन्होंने दो हमें टेस्ट सजेस्ट किया था, तो वो टेस्ट में से जो था वो पहला एसएमई का था और दूसरा एमआरआई था। इसमें नहीं डिटेक्ट हुआ तो इसमें हो जाएंगे बोले। तो उसके बाद में हमने जब कंसल्ट किया उनको, मुझे लगता है अगस्त में हुआ था वो, अगस्त 5 अगस्त को कुछ तो भी रिपोर्ट आया था उसका। फिर वो कंसल्ट करने के बाद में उन्होंने बोला कि उसको जो है तो एसएमई डिटेक्ट हुआ है बोले उसको सेकंड स्टेज में। तो आप एक तो एलोपैथी जो है उसमें करेंगे भी तो कुछ ज़्यादा कुछ फायदा मिलने वाला नहीं उसे, तो आप के ऊपर है कि आपको ये ट्रीटमेंट करनी है या नहीं करनी है। करनी है तो फिर डायरेक्टली आप जो उसका जो एक जो लस आया वाला है उसका जो एक्सपीरियंसमेंट पे है, तो उसके लिए आप ट्राई कर सकते हैं बोला। तो हमें तो एलोपैथी में जाना ही नहीं था क्योंकि उस पर और ट्रायल बेस पे ही था वो, तो इसको कितना फायदा मिलेगा वो अपन ये नहीं कर सकते थे। तो इसमें बाद में फिर अपन ने जब ट्रीटमेंट शुरू किया तो उसका भी स्किन वगैरह का जो है वो बहुत अच्छे से हो गया उसका। स्किन वगैरह अभी डैमेज नहीं होता उसका। हाँ हाँ, पहले का जो था ना तो ये भी जो था ये पूरा उसका जो ये ऐसा बारीक बारीक ऐसे डॉट डॉट जैसे ये आता है अभी थोड़ा परसेंट है अभी, और वो नॉर्मल हो गया है अभी वो पूरा उसका।
ओके हाँ।
और चलने में क्या होता था वो गिर जाता था वो, ऐसा समझो 15-20 फुट चला कि वो गिर जाता था वो ऑटोमेटिकली। तो अभी वो भी पूरा अभी उसका क्लियर है उसका। चलने में सिर्फ वो जो अपन नॉर्मली जब से चलते हैं तो वो स्लोली चला तो वो चलता है वैसे, पर स्पीड में चलने लगा तो फिर वो थोड़ा सा अनबैलेंस होके चलता है वो उसमें। मेन इशू उसका सिर्फ उठने का और बैठने का ही अभी उसका, बाकी का तो बहुत अच्छे से खाना पीना भी है उसका। बाकी का कुछ ऐसा ये नहीं उसका।
उसके चलने में और खड़े रहने में वगैरह पहले से क्या चेंज है?
पहले से तो करता ही हो, उठने में सपोर्ट लेता ही, पर पहले से अभी 50% तो भी फर्क है उसको। पहले उठने में जो बहुत ज्यादा सर्वाइव करता था समझो, अभी जल्दी से उठ जाता है वो। और सीढ़ियाँ वगैरह चलने के समय क्या होता था, ज्यादा जोर लगा के चढ़ता था वो, दोनों हाथ पकड़ के चलता था। स्टेप्स वगैरह जीना ग्रिल वगैरह होता है ना, वो दोनों हाथ पकड़ के चलता था। लेकिन अभी सिंगल हैंड पे भी चढ़ जाता है समझो वो। तो हलो थोड़ा स्ट्रेंथ आ रहा है उसका, क्योंकि मेजर इफेक्टली उसका वो जो है वो SMA2 में पैर पे ही करता है ना वो। तो वो तो है समझो उसमें सुधारना है उसमें। ये कान के ऊपर भी क्या हो जाता है, ये डैमेज हो गया था ये भी उसका। ये कान का हो गया। खाना पीना अच्छे से खाता है वो, अभी 11.6 वजन है उसका अभी। हाँ, जब ट्रीटमेंट शुरू किया था तो 9.6 था उसका वेट वहाँ पे। और हाथ पैर बहुत बारीक हो गए थे तब, इससे भी बारीक हो गया था ये। तो अभी समझो अच्छा है, ये बहुत बहुत वीक दिखता था वो उसमें पहले जन्म।
अभी कितना परसेंटेज में कितना फर्क लगता है उसको?
मुझे स्टेबिलिटी बहुत अच्छी लगती है अभी उसको। जो पहले जो शुरुआती जो दौर में जो था ना वो, तो उससे अभी क्या होता था समझो ऐसा नॉर्मल चल रहा है वो, और अपन खड़े अपने को भी धक्का लग गया उसका चलते चलते तो वो तुरंत गिर जाता था वो पीछे। अभी नहीं होता वैसे, नॉर्मली एक आधी चीज का धक्का भी लगा उसे तो वो स्ट्रांगली खड़ा रहता है वो वहां पे। हाँ, तो वो एक चीज बहुत अच्छी लगी मुझे। दूसरी बात जो है वो पहले क्या होता था वो पैर ऐसा फोल्ड भी नहीं हो। एक मिनट उभा रहा बेटा। अभी जो पैर है ना ये मुड़ के जो है ना ऐसा, तो ऐसा थोड़ा मुड़ के भी अभी खड़ा नहीं रहता है वो, वैसे पहले खड़ा नहीं होता था वो। पैर जो मुड़ के ऐसा जो होता है ना, तो ऐसा भी खड़ा हो जाता है अभी वो। हाँ, नॉर्मली बिना सपोर्ट के होता है। और पहले क्या होता था पैर जो था ना ऊपर नहीं कर पाता था वो, तो अभी मैं क्या करता उसको ना बैठ जाता है ऐसे सोफे पे वगैरह ना, पैर ऊपर करने की प्रैक्टिस करवा था मैं उससे, तो उसके खुद के ऊपर वो पैर कर लेता है ऊपर वो। पहले नहीं हो पाता था वो, पैर ऊपर भी नहीं जाता था उसको। सिंगल पैर जो ऊपर करने बोला ना उसको तो वो भी नहीं होता था। अभी अच्छे से कर लेता हूँ, बहुत ऊपर लेके जाता हूँ, हाफ साइज के ऊपर लेके जाता हूँ पैर ऑटोमेटिकली।
So it's very interesting that his trembling of hands is better, he can write better, his weight is better, his muscle mass has increased, and his entire condition is improving, which according to medicine, it should not have happened. There is nothing that can do it. Okay. So it's better in every way, not only in the muscles, but also in the skin, because homeopathy is holistic, you know. We are not treating the disease, we are treating the vital force, the state of the person, and everything improves. This is only possible, my dear friends, students, by accurate single remedy prescribing. You have to decide what you want to do, what kind of homeopathy you want to practice. You have to decide. You want to be like an average chalta firta, khansi ki dawa, bukhar ki dawa kind of homeopath, or you want to produce results like this. That is your choice. And if you want to do this, it takes effort. It takes study. It takes training. And you will be so satisfied. Let's see another case. So my assistant doctor called up the neurologist who was treating him, and he said, this patient is doing very well. There's improvement at all levels. His weight has increased. He could not stand or sit. Now he is able to stand and sit without support. He was not on any other mode of treatment except homeopathy. The neurologist said, I am prescribing you these medicines, but don't take them, take homeopathy. This is what he told the parents. I want to share a case from a colleague, Dr. Gentiana, my student from Romania. So, this is a case of a 51-year-old woman with a trophic ulcer on the right leg. So, the doctor told me that when she opened the door, in the waiting room, the patient was sitting, and the doctor opened the door. She reacted as if I had detonated a bomb, like the door opened. This exact. What is this? She looks like an alcoholic person, and she looks like a beggar. She actually looks like a beggar, but she's speaking in an educated language. And the ulcer of the right leg is very big, not protected by anything. Go on. Earlier, she was a lawyer. This ulcer is an old trophic ulcer, and it has increased since 1 year. And it was formed on a cicatrice after the old gangrene. That was 20 years ago. There was gangrene, there was a cicatrice. This has ulcerated, and it is progressively worsening in the last 1 year. And when you touch the edges of the ulcer, it is very painful, and it aggravates during the night. These are the symptoms. So we have to look at all levels. What is the name of the disease? Ulcer. What is the fact? The type of ulcer. And then some other areas. Deeper. We have to go deeper. Go on. So the pathology here is trophic ulcer of the right leg. This is how it looked originally. Now, when you take the symptoms of the ulcers, you see ulcers in cicatrice. Cicatrice is ulcerating, dry, deep, adherent to the bone or the skin, burning in the margins, elevated margins, painful at night, painful on touch, painful margins, sensitive margins, and stinging margins. Which is the remedy? Anybody knows? Yes? Yes, very good. Somebody said nicely. Go on. So the remedy for this is asafoetida. You can see the repetization. This is the ulcer of asafoetida. Now, you can see this also. Go on. What is her symptom? Fear from noise. Alcoholism, dull, absent-minded, desire for consolation, fear in a crowd. These were her mental symptoms. Now when you repertorize the mental symptoms, again you get asafoetida. So From the ulcer, if you get asafoetida, from the mind, if you get asafoetida, from the kingdom, if you get asafoetida, from the miasm, if you get asafoetida, you are sure. Go on. So, these were her symptoms from the past. She had convulsions, she had flatulence, ulcers of the duodenum, pain in the lumbar region, also was asafoetida. But what is interesting, when you go in the Materia Medica, go next, you see in Phatak Materia Medica, it described exactly bluish ulcers with highly sensitive edges. Old cicatrices turn purple and ulcerated. Exact description. But what was her delusion? When we asked her, what is your dream? What is your fear? And she said, my fear is this, that somebody will come from behind and stab me in an unexpected way. Just like when the door opens, there's something unexpected, sudden, big attack. Now, that's what we have to look at. That is the sensation of the family Umbelliferae or Apiaceae, where the sensation of this family is sudden, unexpected, violent attack, accident, blow, stab, wound, abuse. This is a plant kingdom. Something happens, reaction, something, plant kingdom. Which remedy in plant kingdom? Which family? Umbelliferae. Because that has the sensation, sudden big attack. Which superclass? Sixth superclass, where there is the theme of violence, aggression, fight or flight. Are you with me? Do you follow like this? And then the symptoms of the ulcer, and then the symptoms of the past, and then the symptoms of the mind, everything. If something happens like this, which should happen in every case, you can be sure about the remedy. Go on, keep going, go on. Yes, keep going. And you see, this is asafoetida, you know Hing, and she was given 200 followed by LM6. What happened? Play. You see the evolution. And this is how she looked after the treatment. She became a lawyer, she became a professional and not alcoholic. Go on. So, next slide, yes. So, this is homeopathy. This is what it can do. But it can do when you are sure about the remedy. Otherwise, it's a chance. And the way to be sure is to look at many aspects. The symptoms, the mind, the miasm, the kingdom, the sensation, the superclass. When the remedy matches all of this, that's it. Go next. You want one more case? This is a case of a 4-year-old child, girl, with recurrent urinary tract infection, epilepsy, gastritis, asthma, and autism. Can you imagine any disease that is left? She had everything. Go on. This is the initial, this case I took as a live case in a seminar in Brazil in 3, 4 years ago. We'll see a little bit about the video.
So, Pearl was born at 30 weeks gestation, and she went through several surgeries. I was 2 years she was in hospital. As soon as she was born, she was there for 2 years. And after she was discharged from hospital, we had the diagnosis of autism. Due to a lot of medication that she was taking, I asked Dr. Carlos to send us to the autism specialist and for us to start homeopathy, because she has severe esophagitis with reflux due to the malformation of her stomach, which worries me a lot because due to the UTIs, which are recurrent, she takes a lot of antibiotics. And that is when I contact Dr. Carlos, and that's when we started the treatment with him.
So, what is the mother saying? The mother is saying she was born at 30-week gestation with several congenital malformations. She was hospitalized continuously for 2 years after her birth and undergone 14 surgeries on her pancreas, stomach, duodenum, bladder and kidney. Can you imagine this? And she came to me with tubes from everywhere, cystotomy, gastrotomy, every kind of tomy was done. There were 4 tubes coming out of her belly. She was severely autistic and she would get antibiotics every week for respiratory infections and urinary tract infections. She was under a neurologist, a pneumonologist, lung specialist, a psychiatrist for autism, and God knows which other specialist was involved in her. And what they said is, there is hardly any chance of her survival. The mother will tell you later that she could not, it was not easy for her to survive. That was the situation in which they brought. You see, can homeopathy do anything? And what can do it? Can I give her some patent medicine? You think? Autismomum. Autismomum 30. What do you think about that? You see, when you use homeopathy for as a like chana mamra, you know, it is like taking Kohinoor diamond and using it as a paperweight. See the value of what you have. If this child can be healed, how can it be healed? And how can you be sure? You make a mistake, the child is gone because anyway she's going. Right? On top of that, now this is the best part, she was getting 3 convulsions a week. On top of all this, and she was getting anticonvulsant treatment. 3 convulsions a week despite anti-epileptic medicines. The seizure lasted for 10 minutes. The last seizure, she had asthmatic attacks. Go on. On top of this, she had asthma attack. What was left? Nothing was left. Go on. She was diagnosed as autism, and severe autism means she cannot communicate what she wants also. She started pulling out her hair, biting her clothes, and developing bald patches. So nobody could understand what pain she was undergoing. Go on. This was the medications being given to her. The mother said, this is a partial list. The mother said she was getting 22 drugs a day. And despite that, nothing was good. Let's hear. This is Dr. Carlos, my colleague from Brazil, who brought this case to me. It was his patient. He brought her to me. Let's see what he says about her.
This child, she was born on September 2014. She's 6 years old now. And probably she's the most severe pediatric case I ever had. Is a very severe case. She was born in a terrible pregnancy, very is after 30 weeks only, preterm, so with a lot of different malformations. She had 14 surgeries in stomach, in bowels, and bladder, and even with brain malformation in bladder, full reconstruction of the bladder is a Mirtofanoff derivation she had. So it's a very, very severe pathological case. And what is the worst on her case is about convulsion. She used to have 3 convulsions.
So, her milestones you can see here. Next. You can see her general symptoms here. Next. And you can see her allergies here. And next, you can see one, she's a very calm and tranquil girl. She does what she's supposed to do. She's affectionate, likes to hug. She likes to remain isolated. But the main thing about her is she's constantly moving. She cannot rest for a single second. That is her main mental symptom. Constant movement. When I saw her moving, you get a little giddy just watching this child move. Okay. But she didn't trouble anybody. She didn't trouble her mother. Opposite of which remedy? We saw already. Tuberculinum, tarantula. This is the opposite. She's very calm, composed, tranquil, but very restless. At the same superclass 5, but a different miasm. Okay? Now, Dr. Kapse, his lecture we heard this morning, you remember what he said? He said that in children with congenital issues, developmental issues, what is the important history we have to take? Did you hear or you were sleeping? Mother's history in pregnancy. If a child has come with such severe congenital issues, there must be something in the mother's history during pregnancy. That is what, because the child is not going to talk to you, right? He's autistic anyway. So in these cases, I have found the mother's history of pregnancy very, very important. I wrote this in my book, The Spirit of Homeopathy, 35 years ago. The mother's history in pregnancy is the most important thing in young children. So, go on. What happened if the mother has a strong state of a particular remedy in pregnancy? The child's remedy is often the same. You can prescribe with confidence. Go on. This I wrote in The Spirit of Homeopathy, my first book, published in 1984. Go on. Now, what was the mother's history during pregnancy? She says, I was bleeding, I had hypertension, I had diabetes, and I was always on the alert. Always on the alert that something will happen. This is very, very important. This always on the alert is 5th superclass. So when we describe the superclasses, we can describe all these qualities. Restless, always on the alert. You know Rustox, always moving his feet. Zincum, always on moving the feet. So alert, something will happen. Right? Go on. She says, I felt that there was a lot of pain in my hips Lot of pain on my hip, stiffness and tightness of the hip. I had to keep on moving and walking in order to feel better. There was an impatience in me. I could not rest. I had to keep moving. Can you understand like this? Can we see the same thing in the child? Always moving. Okay? And then one back. And what is her physical symptom? Pain in the hips and cannot lie down, cannot turn, too much tightness, better by walking. Which remedy it reminds you of? Roostocks, yes or no? Stiffness, better by movement. Very good. The remedy we gave her was very close to roostocks. It is not roostocks, but close to roostocks. Easy to understand? Hello? Very good. Now, what is her mind state? I find the mind state very, very important. But mind state just doesn't mean mind symptoms. It means to understand the perception and the response of this person. Not just writing down, anxiety or irritability or desire. Like, no. To understand, you have to perceive how the other person sees the world. She says, my husband started smoking and drinking. And this was a lot of stress. Because of this reason, I got high blood pressure and bleeding. Because my husband reminds me of my stepfather who was an alcoholic. And I don't like to remember this because that was a part of my life in which I had no control. I was a small child and my stepfather was alcoholic. I had no control and I don't want to remember this part of my life. So tell me, so I said, it's important for you to share with me, I told the mother, about that part of your life because your husband, what did he do? He evoked the memory of that. Are you with me? You follow like this? And so tell me about that stepfather. He molested me all the time. He is the reference of the worst man that can be on this earth. I feel disgust and sadness and panic. When I was in the bathroom, he would look at me. When I was lying down at night, he was always around my bedroom. I could never get a good sleep. My bedroom didn't have a lock because he would remove the lock and he could come in and he could molest me. He could abuse me. So what she had to do at night? She had to be very alert. Very good. You are learning a lot very quickly. Alert. Where does this alert come from? A sense of perceived danger, threat that makes you restless. And where is this danger perceived? Inside your home. Inside the place where you are supposed to feel the opposite, safe. In that home, you feel threat. What do you want to do? You want to get out. Very good. Wonderful. Which superclass want to get out? Fifth. Change, wants a change, want to get out. Very good. So, when I was 17, I decided to get out of my house. So, restlessness, want to get out, fifth superclass. You got it? Stiffness, better by movement, roostocks. So, we want roostocks, which is also in fifth superclass. Okay, very good. Go on. I was lonely. My mother gave me no assistance. So while my stepfather was molesting me, I had nobody to help me. I was isolated. I was alone. I was molested. My father was the worst human being on this earth, my stepfather. This kind of narrowness, this isolation The miasm is leprous miasm. We discussed, no, in miasms. This is leprous miasm, cancer miasm, leprous miasm. That's what you can see. My stepfather was a highly jealous fellow. He tried to kill me. Go on. What was your experience? I was disgusted. I didn't want to see anyone. This is leprous miasm, disgust. Don't want to see anybody. Yes? And then there is the dream. What dream you had in your pregnancy with this girl, Perola? Perola, Portuguese language, means pearl. Interesting, no? That's her name, Perola, pearl. So she says, in the pregnancy, I saw a dream that there was a battle with the devil. There was a dark battle with the devil. This devil looked like a goat and also a man with the horns but the face of a goat. He had knives in the hand and they were blowing foo, and I lost balance. See the story in the dream. What is the dream saying? So you can, I imagine that, go next, that she saw something like this. I just Googled from the internet. A devil with the face of a goat and with weapons, with horns. This is what she experienced. Probably a representation of her stepfather also, isn't it? This is how her state was like this. Go on. I said, tell. I was fighting with the devil in another dimension. It was a spiritual battle. And when I woke up, I was so tired. Go on. I was desperate. I wanted to get out of that situation. Again, the same. So when you see the experience, it will be the same in life, in the dream, in the fear, in the physical symptoms. It will be a thread. Then you know this is the core experience of this person. Then, in my head, I knew there was a God who will help me. Go on next. And I was fighting a battle with myself. This is her experience. Okay. Go on next. I was dirty. I was ashamed of myself. Now the analysis. Analysis, let's go on. You have to be exact, complete, and deep. This is the mantra of case taking. Exact, complete, and deep. Go on. This I described in my book, which is called Exact, Complete, and Depth, the 8-box method of case analysis. Go on. So, what is the superclass? I have to keep on moving. I have to get out. I have to walk. There is impatience. There is alertness. Which superclass? 5th. Very good. So this is the chart of the superclasses. I am not going to go in the details of this. I have described each superclass exactly. So you can see 5th superclass, restless and must get out. And you can see everything under that. I am going to describe these superclasses in great detail in my forthcoming seminar in Pune on 29th and 30th of April. So if you are interested, come there and we will talk about this, because I can't finish this in 10 minutes. So I'm going to talk 2 days about the use of the superclass idea in homeopathic prescribing with cases. Go on. So superclass 5, restless, must move on to get out. So I know I need a remedy of the 5th superclass. Go on. Then, which kingdom? My father, stepfather did something to me that affected me. It scared me. I was afraid of it. Did she want to do something back to him? No, this is not animal kingdom. It's not him versus me, but what he does to me, something that happens to me. I am abused. I am treated badly. I am injured, or whatever it may be. Okay? I want to get out. Go. Something was happening to me. This is the plant kingdom. Go on. Go next. And in which plant kingdom? Something close to roostocks. And what is roostocks? Keep going. Which remedy we have? Roostocks. great restlessness, lameness, stiffness, better by moving. So Roostox belongs to the family. Which family? Hello? Anacardiaceae. Very good. So in Roostox you have Anacardium mangifera, mango, you know. And Roostox and Rus ven, Rus radicans, so many other remedies. The entire family of Anacardiaceae has stiffness, tightness, better by movement. It's not only Roostox. Okay? So we know it's from the family Anacardiaceae. It is from the 5th superclass. It is from the cancer and leprous miasm. So we know so many things about the remedy we have to give. Like this, you have to build the case. Go on. Now, we have a program which is called Vital Quest. And in this Vital Quest, the sensation of each family is described beautifully. In Anacardiaceae, it is caught, stuck, need to move constantly, motion ameliorates, paralyzed, immobile. This is the sensation of Anacardiaceae. All the remedies of Anacardiaceae have this. Go on. So, too much stiffness and tightness. Keep going. Now, what is Vital Quest? It's a very interesting program that I have created along with a colleague of mine, Dr. Paresh Vasani. And Kyle, maybe you can show them this program also a little bit. If you can. Oh, can you? Suddenly it's not showing. It's a very interesting program. If you see it, you'll enjoy it. Okay, let's go to the PowerPoint again. Doesn't matter. We'll show it later. Yeah. Go next. So this is anacardiaceae. You can see it is represented in pictures also. Caught, stiff, tight, tension, stuck, trapped, blocked, gripped, tightness, limited, restricted, constricted. These are the sensations, like as if something has caught you. Something. So this picture is from a book called Sankaran's Plant Sensations in Pictures, which describes the sensation of all the families. And also the book Insight into Plants describes these sensations in details, sensations of 31 different plant families. It's a very interesting way to look at it. So the miasm, go on. It's cancer miasm in the child, which is control. The mother also used the word control. Keep going. Keep going. And when you see the anacardiaceae family and you see cancer miasm, you see the remedy anacardium. Now, what do we know about anacardium? Can somebody tell me, did you see something in the case that is a bit of a keynote of anacardium? Sorry? Devil and God, very good. There is a battle within oneself. She says, I am battling within oneself. This is the main symptom of anacardium, antagonism with himself. And there is a God on one side and the devil on the other. And she mentioned these two words. Go on. So these are all from the software which is called Synergy Homeopathic Software, which also has Vital Quest and the repertory and so many other things. And you can find out more about it. This is the software that I use. So anacardiaceae family, cancer, leprosy, miasm, the remedy given was anacardium. You can study anacardium also from the Soul of Remedies. This is a book that contains the essence of 100 remedies, and it's very useful in practice. Go on. So the characteristics. I'm fighting a battle within myself. Keep going. Antagonism with himself. What is antagonism? Anta means against. Agony means struggle. With himself means struggle against himself. Okay? See the rubric, antagonism with himself. Main remedy is anacardium. So you are able to see anacardium from every angle, from the family, from the rubrics. Go on. Keep going. Next. Like this angel on one shoulder and the devil on the other. Go on. And you can see here also interesting, her cough, and next, her hip pain, which is better by walking, also you find in Rustox from the same family. Going, keep going. Next. So the remedy was given anacardium. 10M potency was given, followed by LM10. LM 50 millesimal, and follow up after a year, no seizures, no urinary tract infection, no asthma, no cough episodes, no infections, no hospitalizations. Allopathic remedy tapered from 22 to 3 now, and she's off antibiotics for last 5 months. Go on. She has become more aware. Speech is slow, but she has started interacting. Go on. And these are the change in medication. Keep going. Go on. Keep go. Next. No, next. 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 Next slide. Yes. Play this one.
Falou pra ele que ela faz homeopatia?
Falei. Falei, a pneumo também sabe. E ela incentivou a pneumo e o neuro também incentivou. Porque assim é uma coisa que deu certo, né, doutor?
Algum recado pro Dr. Sankaran?
Agradecendo, né? Que não tem nem palavra para agradecer. Na verdade, a gente teve uma nova vida.
All the stomy is gone. You can see, and this is how she developed. And this is how she looks now, and how, one back, and how the mother looks also. This was done by anacardium. Yes. Frequency was given every day, LM10, every day for more than 2 years. Once at night. Yes, once at night. Correct. No, just the LM. Yes. Correct. 1 dose of the centesimal, then LM. So when the song of the remedy matches the song of the patient, there is healing, isn't it? This is that's what we call the other song. Our organization is called the other song. That's why. Go on. So it's a good time to sing, isn't it? Too much talking. Shall we sing together? Are you ready? Okay, I'll sing, then you sing together. Let's see. Sa re ga ma pa da ni sa ni da ba ma ga re ga re sa ni da ni sa re ga re ga re sa ta na di re na ta na ta na di re na. Sing. Ta na ta na di re na. Ta na ta na di re na. Ta na ta na di re na. Second. Ta na ta na ta na di re na. Ta na ta na ta na di re na. Di re na ta na di re na. Ta na ta na di re na. See, 3 times first, 2 times second, 1 time third paragraph. Can we do it? Ta na 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 ta na dhire na ta na 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 ta na dhire na ta na 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 ta na dhire na ta na na ta na na ta na 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 dhire na ta na na ta na na ta na 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 dhire na धीरे ना तन तन न धीरे ना तान न ना तनन तानन तनन धीरे ना तन तन न धीरे ना तान न तन धीरे ना सारे गम पदनी सदनी दप मगरे सतन धीरे ना सारे गरे गम गम पम पद पद नि द नि स स स नि नि द द प प म म ग ग रे रे स स तन धीरे ना तन न न न ना आ आ आ आ ना ना धीरे ना तान न न न ना तन धीरे ना तान न न न ना तन धीरे ना तन न तान न तन न धीरे ना तन न तान न तन न धीरे ना धीरे ना तन तन न धीरे ना तन न न न ना तन धीरे ना हो तन धीरे ना हे तन धीरे ना तन न न न ना Next, I believe that all ragas have healing power. So I did proving of 25 ragas and I created an app called the Raga Therapy app, which you can download on your phones for free. And you can use it to heal yourself and your patients. Please give it a try. Go on. Homeopathy is not just pills, it is the similarity. If the raga matches you, you heal anyway. So the other song, go on. We are in the process. You see, when I sing, it comes from a lot of training. I've studied Hindustani classical music for over 25 years. Otherwise, you see, you cannot sing. So homeopathy is like that. You have to train. And we have given you resources to train in the other song and in Prana in Pune. And especially in Hope, Homeopathy Online Portal for Education, where you hear the best lectures of homeopathy right in your own home. It's an online portal. Go on. So we have courses like this, course on practical homeopathy. Go on. These are all online courses, basic course in homeopathy, advanced course in homeopathy, master's program in homeopathy for 6 months in the other song, university postgraduate courses in homeopathy, fellowship course in advanced and psychiatric course. And what I would suggest, if you want to follow me, join the master class, the Sankaran master class. There are 5 levels of it, and it takes you right from the beginning to where we are right now. We have webinars that are coming up. We have video courses on hope, and I particularly recommend you Remedies with Rajan, where each remedy I have described from all the aspects. Go on. I've told you about the seminar in Pune on 29th and 30th. The topic of the seminar is Keynotes to Superclass, from classical to contemporary homeopath. And come and witness the evolutionary journey. I will take you through the entire evolution. So if you can click this, these are the contact details that you can get for all the courses, etc. Dr. Kamlesh Kakade was a very good doctor here in Pune. He has started the branch, the satellite center of the Other Song, where we relay courses right to Nagpur. And this is also good. These are some things you can click. It's my website, rajansankaran.com. The Synergy software is at synergyhomeopathic.com. Other Song Academy. And if you have any questions, info@sankaransclinic.com. So this is the whole story. And thank you so much for listening to me. And I hope that it was useful to you. I just came here to share with all of you, and my message to you, I want to share just one thing with you. When I was practicing 30, 40 years ago, I had one man called Ibrahim Bai. He was a motor mechanic. And he was also a hobby homeopath. He used to come to my clinic and we would talk. He said to me, there is a book on mechanics, motor mechanics. And you open the book and it says, don't be a slave mechanic, be a master mechanic. And I think this is what we should also apply. There is no fun in being average, mediocre. And I tell you, are you doing to your patient what you would like done to you or to your family? Are you giving him that kind of care? For that, you have to train yourself. Don't be average. The joy of life is in doing your best to your potential. Do it. Thank you.
We will give a standing ovation to Dr. Sankaran. He has done a wonderful job. He taught us so many things in so little time.